Why do we need gel in doing ultrasound? A lot of people think it is for lubricating. Yes, it's partly correct, but it's not the main purpose of it. The main purpose of the ultrasound gel is to allow the ultrasound wave to transmit from the transducer probe through the ultrasound gel and into the skin surface and then into the soft tissue. Most of the ultrasound wave got reflected when it's in contact with the air, and there will be no images on the screen. That's why we put a lot of gel to reduce that air contact, so that it's from the transducer probe, going to the gel and then into the skin surface, trying to reduce any air gap in between. So that's what the gel is used for. As a sonographer, you come across a lot of gel every single day. There are a lot of different types of gel, and a lot of brands, and different design of the bottle. I'm going to talk about some of my experience using some of the bottles and the pros and cons. So one of the bottles that I came across very often is this type of bottle with an open and close cap. So get it from the holder, open the cap with either one hand or two hands while you're holding the probe on the other hand. So you can just flip it open and then squeeze it on the probe or patient. Close it and put it back in. Similarly, this is another brand and manufacturer that produce gel. It's very similar. This open and close cap as well. But this bottle, I feel like it has a little bit softer plastic compared to this. And the other difference is, if you look closely, there's actually a valve in the opening. Plastic valve in the opening. I think it's probably just to prevent things flowing backwards. A lot of people that I've seen will rip the cap off when they're using it, because it's just quicker and easier to just grab the gel bottle and just squeeze straight into the probe or under the patient. Now the problem with that is, because you don't have the cap and the valve fall off, you can have bacteria going inside the bottle that way. Especially if you have a warmer, it's a perfect place and temperature for the bacteria to grow. So if you don't use the gel very often, it's always a good idea to keep the cap on, keep the valve on as well. Okay. Another difference I find with these bottles is that these bottles valve is much easier to squeeze the gel out compared to these ones. So for this one, you probably have to put a bit of pressure and a bit of muscle to squeeze some gel out into your skin. So that's the two types of bottles I come across very often. The second type of bottle that I come across very often is a pull and push cap bottle. It's also a 250 ml bottle, and you pull the cap off like a drinking bottle, and then you squeeze gel on the patient as well. But this one, it's going to be harder to open with two hands, and this is usually not my favorite type of bottle. So because the cap can be quite tight sometimes. There are different brands and companies that produce ultrasound gel. You may think it's just gel. What's the difference? They're actually different. The ingredients and the viscosity, the acoustic impedance. Usually ultrasound gel is a mix of water and polymers. For example, glycerin or propylene glycol. There are also some preservatives and other ingredients. Different brands and companies has their own formula. But I find that there are a lot of difference when actually using the gel for ultrasound purpose. They're usually pretty good, and I think the pH level or viscosity and the acoustic impedance are all pretty suitable for ultrasound purpose. Most of them should have a pH level that's close to water, but they probably have some difference. I don't have all the technical details. I only came across some from the internet that I can find, which is the Aquasonic one. You can have a look and see that there is actually some technical details from gel there, just not just some gel sitting there. So a lot of places you go for an ultrasound, they put this cold gel in the body and then you feel a bit uncomfortable with it. I've been a patient myself, and I would appreciate if there is warm gel. I always encourage people to have a gel warmer if they can. Some of the gel warmer that I've come across, for example, is the external gel warmer that has 3 compartments. Some have single compartments, but 3 is pretty handy. Once you finish one bottle, you can just go to the next one right away and then refill the other compartment. Because if you go through a lot of gel, 3 compartment is the way to go. A personal favorite is actually the ones that comes with the machine. If you have any ultrasound question you want anything to discuss about, leave your comments below and I'll try to find the information and do a discussion or video on it.